The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. With us, we have Canada's cosmetic dentist, Dr. Gelfand. Dr. Gelfand, welcome to the program.
Hello. Thank you.
Now, so your offices, you have offices, I guess, scattered all over Toronto.
All over Toronto. We have many offices all over the greater Toronto area.
Now, you say they all share the same philosophy and approach.
Absolutely.
What is that? What is that?
We want everybody to look good. Everybody wants to look good. Everybody wants to look young. That's what we give them.
Before we get into today's topic, you brought some photos
Yes.
of cosmetic dentistry, some veneers, some Invisalign. Lots of questions for you. Is there a typical patient that you see, and do you do everyday stuff? Do you do fillings, or is it just cosmetic dentistry?
We don't have a typical patient, Randy. We have kids that come in for Invisalign. We have adults that come in for gum treatment, for cosmetic work. We have people in their 20s, 30s, and 80s that come in for full mouth reconstruction, and then people that come in for just some gum work or under sedation if they want to get everything done in one shot, or they're a little nervous, they can be fully asleep.
So sedation dentistry. A lot of people go for that. I mean, a lot of people want that. Do they request it?
Absolutely. You know, there's probably about 25% of the population that are so nervous that they won't come in unless they'll be fully asleep.
Really?
Yep.
Now, is that something common in Canada to do sedation as a dentist?
It's not that common. There's very, very few dentists who actually do sedation.
Okay.
And even fewer that do dentistry while you're fully asleep. And I think that's amazing. I think
is that IV sedation when you're fully asleep?
Everything. IV sedation and full general anesthesia.
Okay.
There's oral sedation, there's laughing gas. We do a range of sedation procedures to suit the comfort level of the person that comes in.
Now, something funny, or at least it's funny to me. You always wanted to be a dentist, or at an early age. Tell me about that.
Yes. Well, the funny thing is that I decided that I wanted to be a dentist when I was 12 years old.
Is that right? I mean, really, 12 years old?
12 years old. I have no idea why. Somebody asked me what I want to be, and I had to come up with an answer. I said, I want to be a dentist.
Really?
I thought about it later, and I decided, you know what, I want to be a doctor. But I was really good with my hands. I still am.
Okay.
That's what people tell me, at least.
Like an art, they say.
Like
something.
an art, yes.
Do you feel that way?
Absolutely.
Okay.
When I work with my hands, when I work on my temporary crowns and on permanent veneers, people always tell me that I look like an artist, and I feel like an artist.
Okay.
And that's the part that I like. I like being a doctor who treats people with his own hands.
You don't look like a dentist. Do people ever tell you that?
People tell me that all the time.
Do they really?
I'm
But people don't like going to the dentist. Is that true? I mean, do you hear that? I mean, do patients tell you that?
I hear this a lot. I just met somebody on a plane. She said, you know what, I hate going to the dentist, but you know what, I like you. You seem like a nice guy. I think I'm going to get your number and I'll call you when I get back.
Okay, then tell me this, though, about patients. I mean, do they say it? Do they come right out and just say, I don't like going to the dentist, no offense? I mean, what do they say?
Rennie, you got it right. That's exactly what they say.
Really?
I have the people that come in and say, I don't like it. Don't take it personally. It's not you, but dentists make me nervous. I haven't gone for a year, for 2 years, for 5 years. Somebody told me that dentists are scary, or in many cases, people just had one bad experience as a kid, and it stays with them for years.
Okay.
Okay. The ones that give dentistry a chance, at least in our offices, are very happy that they gave it a chance. And the ones that are still extremely nervous, we're happy that we can still do the work that they want to be done. While they're fully asleep, they wake up and everything is finished. Everything is done. They don't need to worry about a thing.
Okay, good. Now, let's talk about your background, your training. I'm reading from your website some of the training. Tell me about that in regard to cosmetic dentistry.
Well, first, after the University of Toronto, I finished Tufts School of Dental Medicine. And when I graduated, I started practicing with a dentist. Within a couple of months, I realized that I was teaching him many of the things that I knew, that I thought that every dentist should know.
Okay.
And the one thing that made me realize that this is what I want to do for the rest of my life, in cosmetic and aesthetic dentistry, is a couple that came to that practice from Russia for 2 weeks and said to both of us, we want everything done. In 2 weeks, we want to look good, we want to feel good, we want everything to be as great as possible, and we want it to last for as long as possible. And in the 2 weeks that we had, the dentist, the older dentist, asked me to do all the necessary work. It was
Okay.
thin porcelain, ceramic veneers.
So like no price was no object. Just do whatever.
Price
it
was
takes.
no object.
Interesting. Okay.
And I love that part, I have to tell you.
Okay.
Especially a dentist coming out of school with hundreds of thousands in loans. The result was magnificent. They loved it. They were hugging me, kissing me, crying, both of them, the husband and the wife.
Really?
Absolutely. They went back home. Since then, I had numerous referrals from Russia. People flying, taking a hotel, and staying over for a few weeks, getting everything done, and flying back home. So I have quite a few patients coming from Russia.
They travel.
They travel, yes, and that's great. That's the biggest compliment I have. When people spend more money on travel than they have to spend on their teeth in some cases. So I want to go back. I want to elaborate a little bit on the money part that I said earlier. You know, it was wonderful as a young dentist out of school having this great case that really helped me pay off the loans. But honestly, I realized with time more and more that it was about the smile and about the confidence and about the self-esteem and how it shapes people's personalities and people's lives. The changes that it makes from the second.
Do you see changes in people's personality? I mean, you just fix their teeth and all of a sudden, what?
Absolutely. The stories I can tell you, you know what? We need a whole weekend to sit over here and spend time in the stores. I'll give you an example. Recently, there was a girl that was in a destructive relationship.
Okay.
She came to me, and I really changed her smile. She would never smile. The only way she would smile was with a hand over her mouth.
All right.
And when she was all done, when her smile looked different, she was speechless. She couldn't stop crying. And after the hugs and the kisses, and she left. She came back about half a year later with a different boyfriend, and she introduced me to the new person, which I loved, by the way, because he had a beautiful set of teeth. Randy, you know, she pulled me aside, and she said, "It's that smile, Dr. Gelfand, that you gave me, that changed how I feel about myself. It changed how I feel about what I can do."
So she got rid of the other guy.
Yes.
It gave her the confidence to get rid of this guy.
It gave her the confidence.
Interesting.
Exactly.
That's something you said very interesting. You know, we were in the green room, we're talking, and I said, well, of course you're a dentist. Of course you think a smile is important. And you had an interesting response.
Of course, I'm interested in a beautiful smile because that's what I do.
Okay.
But people love looking better. And it's in the middle of your face.
Good point, okay.
It's right in the center of your face. The human eye is attracted to the face first. When you meet a new person, you see the face, you see the eyes and the mouth and the smile. This is the triangle that the eye forms when you first meet a new person for the first 3 to 5 seconds. And you make a judgment based on what you see, on what the person is like, who the person is, and their level of confidence, on what type of relationship you want to carry on with them.
Now, you know, we got sidetracked, but your training. After dental school, you trained at this Las Vegas Institute. And
Yes.
you say dentists from all over the world go there to learn this. Tell me about that.
This institute is like the Juilliard.
It's for music.
It's for music, yes. It's one of the best places in the world. It's not just to become a better cosmetic dentist. You go over there to become a dentist that can give people the smile that they want, to make it last for as long as humanly possible.